And you are now live.
This is Senate Appropriations Committee, and we're continuing to take up bills that have been referred here. And so we have H-293, which is an act related to creating the State Youth Council. And here to report the bill on behalf of Senate Gov Ops is Senator Polina. And we also have Ameren from the Ledge Council, who was, I'm sure, the drafter of the bill. And so I think obviously we got the bill because it has expenses involved of the council. But if you would like to just give us an overview of the bill and then how the council and memberships would be funded.
Sure. Again, Anthony Polina, Washington County Senate. The bill is actually modeled on the bills that have been enacted, laws that have been enacted in a handful of other states as well as some other countries. It's intended to provide an official means for young people to provide advice on public policies that affect young people. The council would be made up of 28 individuals between the ages of 11 and 18. The initial group would be partly chosen by the Vermont Youth Advisory Interagency Vermont Youth Advisory Council, which is an interagency element that tries to look out for the best interests of young people in the state. People in the Department of Health and other agencies and after school programs, people like that, make up this interagency youth advisory council. The group would meet monthly, well, at least monthly it says, and they could also have the power to hold 4 public hearings a year, and they could use surveys and polls to like come up with other images of how they feel young people are being affected by public policies in the state. They would have a couple of committees that would be standing committees, which I don't remember them all right now. One is the Youth Voice Committee, one is the Climate Change Committee, one is an Education Committee. There's one other one that I'm not remembering right now, but it's listed in the bill. And they would meet.
Climate change, youth mental health.
Right.
Youth mental health.
Equity and race, anti-racism.
So the council would be made up of these 28 individual kids, or young people, I should say, who would be chosen in part to reflect diversity around the state with the people's gender identities, disabilities, racial profiles, whatnot. There would be at least one from each county in the state. Well, at least once a year, this group of youth would meet with the governor to provide recommendations and ideas about policy making. They would also report to the General Assembly. They would report to the Government Operations Committees and House and the Senate, but they would also report to other committees that they feel are appropriate. There's a couple things outlined in the bill that they would focus on. One would be ways to keep young people in the state, ways to improve the economy, and ways to, I think they use the word preserve, I'm not sure what it is, preserve or protect our rural traditions, the rural character of the state. That's really what the bill, that's what the bill is.
There's one area that I would really love to get youth feedback, and that is so much of what we do for prevention, a lot of the ads, a lot of things. And, you know, a lot of kids don't think it's very effective.
Right.
And it really would be good to hear from kids. What makes a difference? How do you communicate? What changes people's behavior? Are we spending the money? If you look at this ad, tell us what you think. And I think so many times that maybe what we think is the right thing. If you ask kids, is this effective with you? Does this have the right message? We might find that they could be much more helpful in our communications and thinking about it. Senator Westman?
Case in point in that much of the tobacco money initially that what has gone into place of it has focused on cigarettes, and it's taken them forever to get to the place to realize that kids are vaping. And the complaint from students that were in our high schools has been that all of the materials that they put out to move people away are trying to move them away from cigarettes when they've all moved on to vaping.
Right, done that, been there kind of thing. Ideally, that's the kind of thing that this council would look at, and if they're able to do polls or surveys, as well as have the public hearings, I think they would address those kinds of issues. I think those are top of mind issues. But
I think sometimes we're a bit paternalistic in our approaches.
well, we think we know best, whereas this, the whole intention of this is to ask young people what they think, so whether they know best or not, they know what they're feeling.
Mhm.
And it gives us input that we can use in making decisions about public policy.
So,
I think it's great. I support it. I'm just wondering, age range starts at 11.
I know, it's kind of interesting.
And it's a 3-year term.
So it's staggered 3-year terms.
Yeah, so at the end of that, the person would be 14, having raised a couple of, kids that went through that phase. It's not that I wouldn't value what they say, but I don't think I've ever seen a group that went that low in terms of age. For you, is that an important piece? Does that represent that younger?
Yeah, I mean, I kind of feel a little bit the same way you just expressed, that it seems kind of young. On the other hand, it started off at 11 seems kind of young, 14 doesn't seem so young. It seems,
Right.
yeah, okay.
I'm wondering if it was 3-year terms and if it's 15 through 18.
but you're not picking up the middle school.
Sorry.
Right.
You're not picking up the middle school.
Well, if they were 15, would.
Middle school?
Yeah.
No, no.
14,
Middle
My
school,
kids. 15.
middle school is,
Our pages,
yeah,
they're
yeah.
13.
And they're 8th graders.
they're 8th grade.
Yeah, our
Okay.
pages.
How old are they? Eighth grade? I forget.
Well,
13,
Yeah.
12 or 13.
six and
Depends on
six-
their, yeah.
6 and 6
The other thing that's interesting about this,
12.
not to distract from what you said, Phil, but I forgot to mention that they're going to receive training in public policy and so-called government operations, how the government makes policy.
Well,
and how
that's
the
worth
government
something
works.
right there.
Yeah.
So having people start off young, learning that kind of stuff seems kind of exciting. On the other end of it, if you're between 11 and 18, that would say between 11 and
Yes,
18,
yeah, it's quite a
you
range.
might be there until you're 21, because it's a 3-year term, you might get 21.
Oh, you
Right.
don't go off and turn.
Yeah, you can serve.
So
But
It's a pretty broad spectrum.
I can't
We
imagine.
decided just to go with what was put in front of us, not to put it bluntly, but
Yeah.
You know,
rather than mess around.
Okay, so Alice and then Bobby.
two things. One is, it's very hard for me to envision an 11-year-old trying to have their say with a 17 and 18-year-old. And certainly if they're up to 21, there's no chance.
Right.
So I think they might be there, but,
Yeah.
and the other, I just don't see them being able to.
A lot depends on how they organize the subgroups.
Well,
Yeah.
they
And also
just
the
throw
leadership comes from the kids, and the young people obviously, but there will be people from the Youth Advisory Council, the agency, Vermont Youth Advisory Council that are
Kind of
help
managing,
help them
facilitating.
facilitate the process to get to know what they're doing. I would hope that they would make sure that everybody gets heard, and I think that's part of what they want to do.
Bobby, you
I have one other,
Oh,
Yeah.
sorry, Alice, go ahead.
So I have here, I see the governor shall
Yeah.
meet annually with the council to hear and receive the council's advice and recommendation on policies that impact the youth. I mean, I don't see ordering the governor to meet with anybody. You know, that really is overboard. I mean,
It's a separation of powers.
yeah, you can order.
I mean, a small one, but so.
I don't know what to say, I mean,
I'm gonna make a motion to take it out or say the governor, the group may meet with the governor annually or something, but you can't just say the governor shall.
Well, we can, and it doesn't mean that he has to.
No, but there's an expectation that he will,
We could say the governor or designee.
or say the governor or his designee.
Do we really want to amend this bill? It's at the heart of it. I can't believe if kids are coming together and offering their opinion, that any governor would not want to recognize their work. I realize it's instructive and he could disregard it, or he could send the lieutenant governor or something, but I don't think anybody's gonna find it in violation of the statute.
right. And I think
But I
it-
agree, Alice, it's kind of,
It's nervy at best.
yeah.
Well, they are young people. We want them to be nervy up to a point.
Well, that's what you expect now.
Well, this is also from our Senate office.
Maybe they didn't notice.
Got an H on it?
No, we know.
They may not have,
I think
we'll
they
give
did.
them the benefit of
I
the
got to, I went back and found that section, but when I read it, I said, holy smokes. We can't even offer advice to the government that he take, and yet we got the kids offering him advice. What's wrong with this picture? So I was gonna have you add legislators and the council and legislators shall provide advice,
The governor shall be.
and the governor shall listen.
Well, like, part of the whole idea is to make sure the kids, the young people have some impact on things. So.
It's fun.
And there's something so powerful for kids to
But
meet.
you know,
It is.
it isn't, I'm not so old, but I remember going through all those years in school. 7th, 8th grade, you have elections of class officers and you get elected to the vice president but eventually you work your way up and get to be president of the class. And-
Well, if you're lucky, and people
Well,
like you.
if
Yeah,
you
right.
promote,
Big deals.
you like doing that but here they're skipping a lot of
Steps.
good years of learning by working in their local school or local town government and then move on to state government. They're missing all that part in between where sometimes you learn to keep your mouth shut and you learn when to talk. And you get taught that, you know, you were born with 2 ears and 1 tongue. And so you learn twice as much by listening than you do by talking. You pick up all these little things as you go through the process, and these kids are gonna jump from high school to the state house.
Well, they're gonna get training.
Right, you're gonna go through a training
And so-
process, and also, if I were one of these young people, and I was on this council, and I was still going to high school or middle school, I would love the opportunity to talk to my classmates about what's going on.
How many children are gonna be involved in this?
28.
Huh?
28. 2 per county.
Well, I
That's
would
a
take
joke
it,
in itself.
I would take it from the opposite direction. What Bobby said, I think the whole point here, if you look at the standing committees, it's to teach them not to shut up. It's to teach them,
Well, the first one is, I don't mean to interrupt, but the first committee is the voice committee or something
Yeah.
like that.
yeah, the Youth Voice Committee and, you know, the Climate Change Committee, for instance. So it seems clearly what we're trying to do is give them the message that they have power as citizens and they should use it and they should speak and they should act. I think that's the big draw here. Not that we teach them to sit quietly, but we put a lever in their hands so that they can do something on these issues.
I think
I think that's
that's
what it
good.
is.
Committee, so I'm just wanting to remember that we have a boatload of bills to get out.
Yeah.
And I think we're kind of envisioning how this could benefit and provide a voice. And in this case, it doesn't carry an appropriation, it carries an expenditure, but as we've heard from the reporter of the bill, this is the cost of reimbursement for the students is a permissible expenditure under the federal maternal and child health grant. So
If you would entertain a motion,
I would like to.
I would move that we pass the bill out favorably.
Okay, so we have a motion to move the bill favorably. Could I have a second?
I was gonna go-
Is that you?
No, I'll second.
I already did.
Oh, you did?
Okay.
So sorry.
I really wish that, you know, the kids who are going to be on this council are kids who do well. I really wish there were the kids who get in trouble with the law, the kids who
Right.
could benefit from something like this won't be a part of this.
You know, so many of the kids that are recruited, like Kids Against Tobacco or the honors
Yeah.
students, et cetera, they're not the kids at greatest risk of.
I'm remembering, do you remember?
But
when
we have a motion.
In a second.
Can I say something, Tony? Yeah, just a clarification about the bill that we mentioned. It sunsets after a couple of years. And there's actually provision in the bill that says that this group will come back with other ideas on how to better structure the group. So we'll do some self-examination as a group as well. They'll propose to the government operations committees whether or not they think there should be changes to the makeup of the group. So they may say 10 is too young, or 18 is too old. They have the option in the
But
bill.
we're not getting the voices from the students
Right,
that
the ones
are.
who are most risk, whatever it might be.
Yeah, all right, really.
So I forgot to mention that, that gives them the opportunity to restructure the.
Oh, they'll never think of those kids.
Well, they might.
They might think of them, but they won't be able to get them on there.
We'll see. So we have a motion that's, and been seconded to move the bill favorably. So unless there's further discussion, I'm going to have the clerk call the roll.
Right. That would be Senator Balance. Senator Brew, yes.
Wait a minute here, you need a better, that's a marker.
Well, Senator Ruth, yes. Senator Nixon,
Yes.
Senator Sears,
Yes.
Senator Starr. Yes. Senator Westman. Yes.
Oh, he can't vote from there.
What do you mean I can't vote from here?
You can't, it's against the rules.
What rule was that, as long as I'm in the
That
room?
one has to be in their chair or.
Yeah, well, you've been on the screen and we've listened to you.
No, you can be remote, but you have to be, on the screen.
This is not remote, this is right
People
here.
cannot see.
Put up with this stuff?
You brought all that trouble
So-
in, we never had that.
We've never had this trouble.
Need a reporter.
I'll be happy.
Okay, thank you.
Help at all if I'm sorry, did you take the vote?
So, yes,
Yeah, I
now
can
we
give you
have,
this, which is the email from David Englander.
Yeah,
I'll take it out of the appropriation.
oh, yes, that's very helpful for the reporter, so we can say the impact on the state.
So, did you see my email too?
What, on youth council?
So,
We got it from David
No, I got
England.
it. I got it.
so is this a health department funded thing?
Yes.
Oh,
Using federal money.
One, you want to report it?
well, I expected to, but if he wants to, he can have it.
Oh, why, did you want to report it?
He does health
It
department.
is my health department.
I think you should, my point, Senator,
Poor Richie missed out.
My
He
point,
wasn't sitting at
Senator-
the table and you're on the
So,
menu.
Senator, my point is you have to be visible. That's the remote rule. Nobody can see you over there.
Oh, he's got you on a loophole, Richie.
So that was my point. You cannot
You are
vote
not.
there.
So why don't you just move over by Senator Polina and cast your vote where people can see you?
And as Doyle said,
Yes.
you don't have a seat at the table, you're on the menu. So
That was Bill Doyle who originally said that?
Oh, I've heard that said lots of, thank you, Anthony.
thank you.
Our next bill is also GovOps and it's the chair and it's licensure of mental health professionals.
He's aware of that.
You're not reporting that bill, are you?
No.
Senator White is on her way.
Okay, great. Thank you for
thank you,
coming in.
Anthony.
Thank you, folks.
Governor, so-
Thank you.
Oh.
Senator Starr.
Thank you.
Oh, great.
Yeah, it's unbelievable to me that you detailed that to us. Especially with all the, carve-outs and just signed the medical
The
model.
bill is almost the same as the past 2 years ago.
I mean, he saved face. He was like, oh, they made changes, now it's different. And I'm like, not really. But it's an election year for him too.
You have to take over in there.
What do we
He
do?
wasn't running again.
We're going to do St. Albans Charter as soon
This
as
session, a lot different.
McCarthy gets there.
His deal, this thing on the pension,
Senator Nixon, that is for you.
Thank you.
Yeah.
that's a bad.
Sears
Oh, thank you.
and we voted the Burlington and now we
Okay, so this is me.
go patient.
We don't have the amendments yet to 720.
Yes, we do.
Oh, we do.
We do.
Because we probably should move that out, and that's, Senator Westman would be reporting that bill.
You want me to report it or is he?
Your report.
You are, okay. You're reporting the one on youth, but you're also reporting,
He pushed me out.
Alright.
He pushed me out.
I didn't know.
So don't forget, we're still online.
We are live.
And the other bill that I'm talking about is H720, Senator Westman. Remember, we had the issue, on testimony yesterday about the requirement for annual reviews and other changes. We did not want to vote the bill out until we actually had a chance to see in writing the changes before we voted the bill. And
So this was the bail one yesterday?
this is right, and it's the one about
And you
providing.
didn't do it after I left?
No, because we didn't want to vote it until we had the amendment in hand, because you'd have to take it up. And we just didn't get the amendment until later.
We were reluctant. to
So,
have it.
This is the bill, 720, and that's the system of care, and it had to do with obviously the positions and the flexibility and the testimony we heard.
And we made the right decision within the budget.
Yes, we did. And then Stephanie pointed out that we needed to use the term strike out appropriated and use allocated, because it had already been appropriated. So with this now amendment in our hands, are we willing to move the bill favorably as we've amended it? Okay. So do I have a motion?
I'll move it as amended.
Okay, Senator Weston, seconded by Senator Brewer.
So vote on the amendment first and then.
Yeah.
Yeah. So Senator Bell, Senator Baruth, yes. Senator Nick,
Yes.
Senator Sears,
Yes.
Senator Stark, yes. Senator West,
Mhm.
Senator Kitchen.
Yeah. He's testing all the parameters today.
Well, I didn't put the.
Now I would like a motion to move the bill favorably as
So
amended.
moved.
All right, Senator Westman, seconded by Senator Starr. Further discussion? If not, we will call roll.
Senator Bell, Senator Baruth, yes. Senator Nick,
Yes.
Senator Sears,
Yes.
Senator Stark, yes.
Yes. Yes.
Senator Kitchen.
Yes.
601.
The reporter is Senator Westman.
Senator Weston, can you fill this out for me?
Mhm.
Thank you.
All right, so we are now joined by Senator White from, no, this is judiciary. You're reporting on behalf of judiciary?
No, this
No, no,
is
H6,
H661. Did I hit that the wrong one? H661.
It says licensure of mental health professionals.
Creation of position with the,
Yeah, go up.
Says Senator Jeanette White sponsored Senate Judiciary.
again, this was, remember today we were saying that
I have
the
no idea.
populating
Oh,
random things today, so
I-
I apologize to you.
all right, so you are
What am I
here,
reporting on?
right?
661.
661.
Okay, or I could report on something else if you'd rather.
No,
Yeah,
we will go
report on
with 661. But
Like
it
it
was
was
a
on the
little
water bill?
confusing because I wanted to make sure it wasn't judiciary that had
Right.
taken action
This
on
one you don't need to
the
say.
administrative reporter, since you happen to be on that committee.
Yes.
So 661 is licensure of mental health professionals. So thank you for coming in. And
601.
Mr. Sam.
no, I'm sorry, I do have to leave my phone on if something
That's
happens.
fine. I know, it's okay. We have similar situations in many committees.
So 661. We have a new classified position.
Yes, they are asking for, I assume that's why I'm here, is not because of the content of the bill, the continuing education requirements, but because they are asking to have one more position for the oversight of the supervision of mental health.
And these will cover the cost of the additional position.
They will cover the cost of the position, is my understanding, and I don't know if Lauren Hibbert is coming, but that is my understanding.
So we're limiting ourselves to the Seneca Oxymeter,
Well, there,
or are we?
well, the whole bill is our, I mean, what do you mean?
Well, in terms of what appropriations purview is there money in here too?
There's a position.
Right.
But the underlying bill that you're amending, did that have the position as well, or?
No, I'm sorry, it did not. The underlying bill did not have the position, and they asked
Yeah, so
They asked
we're-
for one, yes, I see what you're saying.
Yeah.
I considered it all the same bill, but yes,
Okay.
So
So it's pretty
the underlying bill was strictly related to The licensure.
The licensure and more continuing education units, and the creation of a report that would come back from OPR about the possibility of streaming licensure of mental health professionals practicing in the state, whether they needed additional regulations for supervisors, that kind of thing. It was a report coming back, but that was the underlying bill.
Okay, obviously, the more we have for requirements that continue, we want to have people proficient, but I think this is probably going to add additional costs then for the coursework and the continuing education credits, if we're increasing them.
I don't, we're asking that they now have continuing education units in systemic oppression and anti-oppressive practice or related topics. And in the recommendations, they're not going to be implemented until the recommendations come from the Health Equity Advisory Commission, which apparently was set up in 2021 and is coming in with recommendations around just what should be in training for mental health professionals. And one of the things that we heard, which is understandable, and I will say that some of the language in here is very kind of jargony, and we had long conversations about the use of the language, but we talked about, for example, cultural humility, and that's a jargon, but essentially what it means is that if you're a mental health professional and if you've only lived in Boston, in urban Boston, and then you move to Burlington, and you're being a mental health counselor for somebody who lives in very, very rural Northeast Kingdom, there's a cultural difference there, and you should have the humility to acknowledge that your culture isn't necessarily better than that person's culture. That's all it means. It doesn't mean that I'm saying my culture is better or that I have to acknowledge anything else. It's just saying that you need to acknowledge that there are cultural differences that, and particularly if you're dealing with mental health, people in mental health crisis, that you need to acknowledge that. So a lot of this is kind of jargon language, but it really, or if you happen to be from the southern part of the state and you're dealing with someone from the Northeast Kingdom, you might be tempted to say, your culture is really,
particularly if you're from the northern tier of the Northeast Kingdom.
if you live near the Canadian border, I'm sure you would, that those of us who live near the Massachusetts border would tend to say, oh, you're in a whole different world. So anyway, sorry about that, Bobby.
I
just
want
couldn't
to
resist.
take just a second to thank the chair of government ops for
Recognizing your cultural difference.
making sure that that's in the bill, because I'm sick and tired of being insulted from where I come from.
Yes.
That never happens to us in Burlington.
Or for those of us from the Banana Belt.
So
that
basically
is the position.
because of your amendment to add the position that will be funded through the fees.
Yes.
And this is supported, I assume, by the entity being licensed.
Yes, and OPR asked for it, and because they have so many mental health workers now, and they don't have enough supervisors to.
Is that employee gonna come out of the pool, or how does that work?
It's created. We're adding.
You're creating a new position. A whole new position.
Because it's a growing population of licensed professionals. We need more, frankly.
We need many more, and then if they were in 2015, they had 54,000 licensees, and they have the same number of supervisors now, and in 22 they have almost 76,000.
Oh my gosh.
So
So they weren't working very hard before.
they were working very hard before, and now they're not going home at all.
All right, so other discussion about the bill? If not, Senator Starr from the northern tier of the Northeast Kingdom is made a motion to move the bill favorably. And I need a second.
Second.
Second, okay. Senator Stewart.
And
We've got so many papers.
are you calling for discussion?
No, I,
Get your stuff out.
so if I can have any further discussion before we call the roll.
Could I make a comment
You
about
may.
your comment about Senator Byrd having many papers? At the chair's meeting the other day, I sat in his chair and I had to be very careful not to touch anything because it was about to topple.
Yes, it's all very well.
Yeah.
I might note that Elizabeth Reedy used to have that type of,
Well, I will tell
as
you,
did John Campbell.
as did Claire Eyre in finance, sat between McDonald and Rod Gander. And they both had papers like this. So she got that blue painter's tape and put it on her desk.
There's a little spillover.
Yeah.
Okay,
Okay, sorry about
a
that.
shadowing, I think that's what they call with your septic system.
Okay, first vote on the amendment,
We will, no, we're not amending at all.
but it didn't go ops.
They
Well,
amended
yes,
their.
you're
Oh,
voting
but
to
we
see-
didn't amend it.
You're not amending, you're voting to
We're
support.
voting to move the bill favorably.
Okay,
Yeah.
Senator Bow. Senator Ruth, yes. Senator Nitka,
Yes.
Senator Stevens,
Yes.
Senator Starr. Yes. Senator Weston,
Yes.
Senator Kitchen.
Yes. Thank you very much.
Thank you.
Who has OPR
What do you mean, who has
on my
open?
committee?
Oh.
Secretary of State.
I thought we did.
You have Secretary of State, Bobby?
About time you got a bill.
All right,
No, it's not even.
no, it's Bobby, please, OPR. Now we're ahead of schedule, right?
We are ahead of schedule, so that was Senator Starr.
Yes.
Okay, yes, and I asked to see if Jen could come in earlier, but she hasn't responded. Do you want to get Senator Lyons here and see if you can rolling?
What would be the one?
Right now, we do have the whole group who's here for the hearing aids.
Yes.
So we can start with them, but I do want Senator Lyons in the room.
Yes, all right.
Okay, and then, just bear with me
I'm
one
being
moment.
used, but
So that was
I'm being
661.
confused, but
But we're ahead and of 3, and so there might be people who would be coming in at 3. That's right. Who would want to observe our action on the bill. So even though the interpreter's here, I'm wondering if in fact some of the people who really want to be here when we take the vote would not come.
I have a little bill that nobody's gonna argue with, and it doesn't need anybody to talk about.
So why don't we do that?
You like to just do it quickly.
Chris Brady.
Thank you.
The
You sign it and you put the.
Victims
quote on
Comp
there.
Fund bill,
Thank you, sir.
I think
And then
it's 505, Victims Comp Fund.
505, let me pull that one
I
up.
believe that's what
And it's the one that allows domestic partners
Yeah.
to
it just
be
basically
eligible.
does nothing.
If you give me.
Well, I mean, it does something, but it's not,
Uh-huh.
it's something they're already doing.
if it's doing nothing, what are we?
It's sanctioning the current practice, in
Right.
other words, it's making it, okay.
We're doing it.
What?
Well, I thought she said they were. We went so quick on it, Alice. You probably have proper notes.
I voted no.
Oh,
You voted no?
Because it's 6 months.
Because it's 6 months and the fact that they're having trouble with their budget and they're putting a new group in, not that it's a very big group, but they're putting more people in. And they're having, look at the trouble they're having with their budget.
Senator Sears, you said 505, it's
I
the,
thought it was.
that's
505 is
penalties and
wrong.
unlawful
I would
possession.
view it as an
Is that
equity
what
issue.
Oh, okay.
Not that one, let's see.
Hardly, it's not, it's somebody that lives here for 6 months.
Let's see what we have in committees.
6 months can be a long time.
Well, the vote in committee was 401.
Yeah.
Yeah.
No, 410.
What?
410.
Oh, 410.
A lot of marriages last less than 6 months.
Senator Sears, is it the one with the domestic partners?
Yeah.
553?
$3.99,
No.
553?
$5.53,
Or even close.
Which
$3.99.
bill are you talking?
That
I'm
sounds like,
losing ground.
seems like a sale.
Oh, that was 601.
Okay.
Pull that one along.
But they like you.
Committee, just a second, of course,
Thank you
we're
very much.
still on live, we're still live.
They're still on.
And so what we're trying to do is respect the fact that we had specifically said that we would deal with H266, which has to do with health insurance coverage for hearing aids at 3 o'clock. We had a request for an interpreter, and I'm sure that it is because there are people who would like to observe the action of the committee, and therefore I do not want to take the bill up early and have people come in and find out that action had already been taken. So what we're trying to do is find another bill that we can move out and hold H266 until 3 o'clock. And I realize we have 2 interpreters waiting, and they're here in plenty of time, but I don't want to move action on the bill until when the scheduled time is 3.
Here is the amendment, but I'm still get the underlying bill to each of you all. This is as it came out of judiciary, so you have to bear with me.
The underlying bill is on it. Just was a mistake at the end.
Thank you.
All right, so what we're going to do now is move to House Bill 553, and it has to do with eligibility of domestic partners for reimbursement from crimes compensation program.
Yep.
Victims compensation, I mean. So Senator Sears, if you want to describe the bill.
It's a small group. This just adds domestic partners to the bill who are not people that are not related by blood closer than with bar marriage under state law. That was the change that the Senate Judiciary Committee made. So that there are people who are, so that it's domestic partners who have been more than 6 months. As Senator Nick has said, that was the one bone of contention in the committee, but we don't believe there's much to it. I think the fiscal note was pretty small.
Was this supported by a
This is
network?
supported by a network and the Center for Crime Victim Services. Jennifer Coleman spoke to the committee and strongly supported it. There's actually, the bill was introduced at the Center for Crime Victim Services request.
So we have, obviously, this is payment out of the fund, which has been in deficit. So we've had some action to try to get that stabilized in the budget, and or at least part of the
Yeah, so you
expense.
can't add if you live with your
Other
sister.
comments or discussion?
Or is that right?
Yes, Senator Nick.
I
Yeah.
voted against this in our committee because the fund is having trouble. They don't have the money coming in that they used to have from tickets, tickets for speeding, et cetera. And also, I have to admit, someone just living with someone moving in for 6 months, you say they're a domestic partner. They're not official domestic partners. They're just somebody who's not one of these categories, who's there for 6 months and they can take advantage of the fund. So it's not too many people, but I still think on principle, I wasn't gonna vote for it when their fund's in trouble and they're wanting to expand it, a couple more people. So
These are victims.
So if that's 1 year instead of
Partners,
6 months, should that make it better?
they wanted it 6 months, so.
So Senator Sears, if you want to describe the reason why your committee decided.
The majority of the committee decided that 6 months was the appropriate amount of time. So the vote was 4-0-1 in the Senate Judiciary Committee. And we felt that there was little impact, but that somebody who, had lived with someone for 6 months or a year or whatever period of time, and to not be able to be treated as that spouse was wrong or as the domestic partner.
So right now, we're domestic partners are not.
Not
eligible.
recognized as part of the victim compensation if that person was murdered, for example,
But the 6-month standard currently exists in
For-
other.
for other cases.
So you viewed it as an equity.
Yeah,
So if you live with somebody for
For 6
6 months, you're automatically a domestic partner anyways, other than this law?
Other than those that are exempted who are prohibited from legally marrying one another or not related by blood closer than would bar marriage under state law.
It's,
Boy, that's gonna give a lot of people a lot of help with some money maybe.
Well, you first have to be a victim,
Well,
then you have to not, and the
And
victim,
that,
You have to be the partner of the victim. The
you have
victim
to be the
continues
partner of the victim.
Victim
And
is
the
a-
victim would have to be dead or seriously injured for you to collect anything, from them. And then there isn't any insurance, so you're not talking about a lot of
it
people.
isn't a monthly
no,
installment.
no, no, no.
Oh, no.
No,
There's a limit of, I believe, $10,000
Yeah.
per case.
it's probably a need for counseling or something like that.
yeah, whatever damage was done, they're not gonna make you whole. It's a gesture on the part of the state.
Okay, so the vote in committee was 4-1-0. Senator Nick has explained her reason for her vote. The chair of the committee has explained the reason for the decision, and that is basically recognizing, even though we recognize the fund is under stress and underfunded, to not address the equity issue, it doesn't
It's
seem
an
to
equity
be,
issue, really.
it doesn't seem to say, we won't allow you in and others in simply because of the condition of the fund. And hopefully we can get that stabilized with what we've done in the budget.
We've done some good things in the budget. Some people didn't like.
I think we did a fine job of threading the needle and making
By the
it
way,
very clear.
The network was very happy.
28-2 is too bad.
No, it's not a bad budget.
But this had to do with where we put the 2.5 million
Right.
for the funding of the positions in the state's attorney's office. But I think having a separate line allows us as legislators, whoever is doing the budget, to clearly see that those positions are being funded. So I thought that was a good suggestion, and thank Stephanie for coming up with it. Other discussion about H553. If not, I'll entertain a motion to move the bill.
So moved.
Okay, Senator Westman, second by Senator Starr.
Senator Allen, Senator Baruch, yes. Senator Nidkin,
No,
Senator Sears,
Yes.
Senator Starr, yes. Senator Westman, yes.
Yes,
Okay,
and
5-1-0.
and
That was your
Senator,
consistent. I let that.
Senator-
5-1-1.
Senator Sears, you will report the bill?
Yeah.
Okay, thank you.
Excuse me, Senator Stewart, could you put the committee vote 511 and sign that for me? Thank you. Thank you.
Sounds like a emergency number.
So we do not have Jim Harvey until 3. Would you like to take a break and come back at 3?
Yes, I think that would be a good idea.
Okay.
It's what's on now?
It's 2:36.
Yeah, I think that would be good.
All right, so we're gonna go off live. We're
And
gonna
we've
keep
already done 7:20.